Bismillahirrahmanirrahim. Good evening, everyone. My name is Ariba Lalani, and I welcome you all to our Health Insights webinar titled COVID-19 Vaccines, Update on the Third Dose, Booster Shots, and Mixing Vaccines. As we know that several variants of COVID-19 have been found to spread more rapidly than the original strain, which has caused some concerns about how well the currently deployed jabs will hold up. To give us more details on the current situation and on the mixing of vaccines, we are honored to have with us Dr. Mohammed Virji. Dr. Virji is the Assistant Dean for Medical Student Affairs, the co-director of the Primary Clerkship, and an Assistant Professor of Family Medicine and Clinical Medicine at Weill Cornell Medical College, Qatar. After years of experience and teaching and practicing family medicine in the United Kingdom, Dr. Virji moved to Canada in 1994. In 2003, he was appointed as a clerkship director at the University of Calgary and has been in the Gulf region since 2007. A widely published researcher, educator, motivational speaker, and a practicing family physician, Dr. Virji has a long list of achievements to his name. As this is a question and answer session, I encourage you all to please type your questions in the Q&A box below or in the chat box below. Without further ado, I would like to welcome Dr. Mohammed Virji to share his expertise. Over to you, Dr. Virji.
Thank you, Ariva. It's a very kind introduction. Good evening, everybody. This is an opportunity for you to ask all those unanswered questions so far. First of all, I hope that you're all safe and staying well, and that none of you had any significant problems. Here is the time to ask me whatever you wish on the topic, and that is booster vaccines and mixing vaccines. We're going to try and confine ourselves to that area because that is of topical importance. So I should now hand back to Shahnaz Mohammed to lead the questions. Thank you.
Thank you, Dr. Virji. Yeah, so I was just going to say, I was going to start with a question that seems to be the most common question, and that is whether mixing vaccines actually trigger an immune response.
Well, that's a question which I need to address distinctly in several parts. First of all, mixing vaccines is not the normal practice. And what has happened is that people have moved around parts of the world and have got one vaccine in one place and another vaccine in another to complement the second dose. This has been done by accident rather than by design, where the same type of vaccine is not used for the second dose. In addition, there are some protocols where you need to have one vaccine repeated in 3 weeks, which is the Pfizer vaccine, and the other one commonly used is Moderna, which you need to have repeated in 4 weeks. But because of the shortage of vaccines, various countries have delayed, like the UK and Canada and the US, they have delayed giving their second shot for up to 4 months. Now, by chance, some people who actually had a first vaccine either didn't remember which one they had or recall the wrong one. And they got a different vaccine for the second shot. They didn't have any side effects. And when the error was, the documented error was discovered, the various authorities said, oh no, we made a mistake. And they checked these people who had had this second different vaccine, and they found that the vaccine was even better than 2 doses of the same type. That news has unofficially got out now. And there are 2 things that arise from that. First of all, people are less, shall we say, diligent about getting the same vaccine rather than 2 of the same type, because they hear it's as good without any side effects. And the second thing is the availability. So there may be some countries which have been using Pfizer, and then suddenly supplies run short, and then another one like Moderna comes into stock, they want their second shot, and they get that one because it's there. So the answer to the mixing by, shall we say, a chance finding has no fear. And for those people perhaps who are immunocompromised, who have a less active immune system, this actually is, in a way, a bonus. What is good is both the established Pfizer and Moderna vaccines have the same capacity to withstand the current Delta vaccine, Delta variant of the virus. I don't like saying one country's virus. I think that's probably discourteous. It may have originated in one particular country, but it doesn't mean to say that they own it. So I prefer to use a different variant, and both Pfizer and Moderna are equally effective against the new Delta virus, which currently is reaping through India itself. It has done, and Nepal, and Bangladesh, and Pakistan, and has spread to Europe and the UK, and now is in every state in the US. So I hope that's a long answer to a short question, but I hope that clarifies.
Yeah, so to summarize, what I'm getting from your answer is that the normal practice, the recommended practice, is to take the same kind of vaccine. And accidentally, like you mentioned, it was shown that when a different vaccine was given, it was still, but those are like special circumstances when those things happen. It might be a supply issue or somebody forgot. Otherwise, just to emphasize to the audience that the normal practice, the recommended practice, is to take the same kind of vaccine. Yeah, so that was a segue to, just to recap again, because that's another question that came up. Yeah, it's a segue question as to whether the vaccine is effective with the new variants, because this is what the fear is at the moment with the Delta variant, and especially in the younger population, because it seems to be more infectious in the younger population. So whether it offers equal protection in the younger people as in the older people against the new variants and against the new more variants.
Well, the regular change to permit children from the age of 12 up until the end of their 15th year, in other words, some years, to have the same vaccines which are being given to adults in adult doses, and they are equally effective. The side effects tend to be less so in younger people, and there is no contraindication to the vaccines being given to the 12 to 15-year-old age group.
Okay, and there was another question. What about for those younger than 12 years? Will there be a policy coming around that? Is that something that's being looked into?
Well, go back a little bit and say the evidence for giving the or adults the vaccine have come from clinical trials. So they've had 30, 40,000 people who've been tested, and then they've drawn the results from that, proven its efficacy and safety. And then, of course, we know we've had a long ongoing campaign. Now, they also have done research on 12 to 15-year-olds, and that has been in a smaller cohort, less people tested, but they already have the evidence from the first study, and they have found not a single problem in the trial group, the test group, the clinical group in the 12 to 15-year-olds. It is a smaller group, but they had not one complication. So that has gone ahead. At the moment, it's rumored, and I don't believe in rumors. I believe in fact. But I understand that they are planning trials for 12 and under, from 5 to 12. That may be the next trial. It may have started already, but we're not aware of it. Now, you may well ask, going one step further, what happens to the under 5s? And when can you start vaccinating? Well, going on the flu vaccine as a kind of record, it usually starts, but that actually is very much in the distance. Now, if you think about how the virus is now invading the younger population, let's think why. That is because certainly in the UAE and to a high degree in Qatar as well, and also in the US and in the UK, most of the adults who are vulnerable have been vaccinated. Up until a point, children did not seem to be affected either so badly or at all. Now, the virus may be a simple virus, but it has intelligence, and it says, if I can't hurt this adult, I'm going to find another person. Are those unvaccinated, which is the younger age group. Delta virus, which is now going around the world, is 80% more infective than the original virus. 80%. So it has a high N value, an infectivity value. Originally, the virus would, if you had one person who got infected, it could infect 3 more straight away. And those 3 more, in fact, 3 more each, and it goes on from there. So it rapidly builds up. And now with the Delta virus, it is a question of 80%. So the chances of, if there are 5 people in the room, 4 of them will get infected from one person. And that causes a proportionately higher infection rate.
Yes, it's going to be interesting moving forward with the trials in younger people and what's going to happen. There's so much unknown, I think, with this virus. Yeah, so that makes sense. So there's an interesting question here from a lady who's saying that her daughter has an anaphylactic peanut allergy, and she was given a single injection from Johnson & Johnson. And she's saying that what should she consider for a booster for the next jab? Should it be a different vaccine? And her daughter is in her 30s.
No, she should not have a different vaccine. She should have the same, and all her information should be declared to the doctor or nurse who attends her. When she has a second dose of a second dose vaccine, she will need to let the authorities know. They will have it on record, but still repeat it, let them know. And she will be kept under observation for a minimum of half an hour. If there is any kind of allergic response, it's going to happen within the first 5 minutes. If nothing happens within 5 minutes, she is going to be through any kind of risk. But they will keep her half an hour. So if you do have a declared allergy, please expect and take the time to plan for the time to stay there for half an hour. And don't get impatient, because it could be life-saving. But even after 5 minutes, and there's no problem at all, say the answer is no. So don't be annoyed and don't be unkind and say, but you know, I've got to do this or whatever. I must admit that peanut allergy, a true peanut allergy, although it's talked about as being common, is very rare. And in over 30 years of practice, I have seen only one patient who had that. That doesn't mean to say it's not out there. It's not that I don't believe in it. It's just that the chances of anything happening or having a true peanut allergy is very rare. So giving something like that, the injection is protective for the virus, but will not impact the peanut allergy. However, all allergies must be declared.
Okay. Yeah, so that makes sense. So take the same kind of vaccine and not switch the vaccine just based on that allergy information.
Correct.
Yeah, and they're really good at monitoring when they're giving the vaccine. They let you sit there for a while and make sure you're okay. Yeah. So there are a lot of questions on go through them. So one of the questions says, can we take a booster after 3 months for the second dose of Sinopharm? So they had the Sinopharm, and can they take the booster 3 months later?
Well, there isn't anything like a booster as such in regular protocol. I think in medicine and science, it knows no geographical boundaries or political boundaries or economic boundaries. The Chinese were very fast to try and find a vaccine. And the studies that were, the figures that were released in the West showed that it had a 51% efficacy, which is not like the 95% of Pfizer and the 95% plus of Moderna. I had a lot of questions from people who said, Sinopharm is not a good vaccine, is it? Because it only does part of the job. My answer to them was, without Sinopharm, what protection do you have? Zero. Wouldn't you rather have some protection than no protection, even if it seems to be low? And they said, yes, I understand that. Now, the figures have been reevaluated, and they've been shown that 51% was a serious underestimate. And in fact, the efficacy of Sinopharm is more like 76%. 76%, very different to 51. There is no need for a booster if you have actually had 2 Sinopharm injections. There is no indication for it. There is no need for it. And I'll go one step further, and this is an important point. The 2 doses for that one person is really the share of the vaccine which is available in the world. By having a 3rd shot, please remember that that 3rd shot could be a 1st shot for somebody else who hasn't had any vaccination at all. I leave that to your moral conscience to think, would you want to have a needless 3rd shot when you've got good protection and someone who is not protected has none? There is nothing to indicate an official booster vaccine at all. There has been talk about it, but nothing has been decided. And we don't even know how long the present makes of vaccine are going to be effective for. 6 months, 1 year, 2 years, or whatever. And as you said, Shanaz, very rightly, there's so much that we have yet to find out about this virus that we cannot make assumptions on simple anecdotal evidence.
Yeah, so you answered that so well, because as I'm scrolling through the question, there are tons of questions all saying, I've had 2 shots of Sinopharm, can I take a Pfizer booster or a Moderna booster? So I think what you gave in terms of effectiveness of the vaccine and the fact that you're covered now, you've got immunity. So just have that peace of mind and not go crazy about, percentages, right? And I think that's what's happening. So I have another interesting question, and I'm not sure how that would be answered. Somebody's taken 2 doses of Sinopharm, but it's not accepted in Canada. And they're saying, so can they go ahead and do Pfizer then so that it's accepted?
Yes, that's a very good question, and to one I don't have a complete answer. So I know that there are people who, having had Sinopharm, which is not recognized in certain countries, in Canada and the US and the UK are part of them, they are stuck, because that means that if they go there, their vaccine is not taken as sufficiently good in the, if you like, acceptability compared to the recognized ones. And so there's a temptation to say, let me take should we say, an upgrade of a vaccination to qualify. Now, the question is that to have complete efficacy is one, if you like, extra dose sufficient to give you protective immunity? And the answer to that is possibly. We don't have figures on that. We don't know the evidence of whether that is good or not. But there are one or two circumstances which I know have been written about, which says having that third vaccine, even though it's not indicated, doesn't harm you. Now we come to the point which is very interesting. If you have one recognized make of vaccine, forget about Sinopharm, and if you like, you present a picture that I have had one dose of Pfizer without mentioning the other two Sinopharm vaccines, what is going to be the effect of having a second Pfizer on top of the two Sinopharms you've already had? That I cannot answer. That is a risk because we don't know what could happen. There could be a serious reaction or there may be no reaction. Absolutely within my mind, professionally, I would say if you had the complete course of Sinopharm and the last dose was 3 months ago, you should not have a third dose and then have a fourth dose. Absolutely not. However, if it is perhaps 6 months plus, and we've only had the vaccine since December, and it's barely July, if you're one of the first ones to have Sinopharm, and then Dubai has been excellent at its program vaccination sweep of getting people, there is a chance that the Sinopharm may be tolerated. But the point here is that these countries which don't recognize Sinopharm need to have 2 doses of Moderna or Pfizer. Now, it's a personal choice. There are places where you can get more vaccine. If you're in Dubai, the DHA does one set of records and privately you can go somewhere else. I don't have an objection per se, but my interest is in safety. And I'm worried about possible harm by taking something which is not recommended. It is a personal risk, and that's up to the individual. I can't control that. That's up to individual choice. But would you want to take an unnecessary risk? So what will happen is if you do have a third dose to get yourself on the list, if you like, if you do go to one of those countries which doesn't recognize Sinopharm, you can hope for 2 things. First of all, that Sinopharm, which has been wonderfully successful in China, certainly, and in the Gulf region, will be recognized. And that will actually remove that constraint. The second thing is if you have 1 dose only and are not fully vaccinated, you will have to subject yourself to the quarantine regulations of that particular country, which will last 7 days. I don't think that's too big a sacrifice to make for safety. And until they have some studies or some evidence that shows that 2 doses of Sinopharm followed by 2 doses of another recognized vaccine like Pfizer or Moderna is safe, then that should not be done. And that goes back to the earlier principle. Here, if you have 2 extra doses of vaccine, having had your 2, think about those who've not had any vaccination at all. Do you want to deprive them of a first dose? That I leave to the personal conscience of the individual concerned. I fully understand and appreciate it is difficult to get into countries which don't recognize Sinopharm at this moment. But I know that one country which is resistant has now recognized Sinopharm as being a valid vaccine. And if you have 2 doses of that, you will be allowed in and not be subject to quarantine regulation. You have to check the countries every day, every week to see what their rules are. And hope that in fact there is a wider recognition.
Yeah, it's certainly a tricky situation for sure. And there is no clear answer, and I can appreciate that. And these situations are evolving as we go, I find, with the pandemic. So there was a couple of questions from the same person, and I just wanted to clarify because I'm not 100% sure. But the Johnson & Johnson, the person is asking, isn't that a one-shot vaccine? And
Yes.
this is, yeah. Okay.
Johnson & Johnson is a one-shot.
Okay, because it's to do with that lady who has a daughter with the peanut allergy. Like
Yes.
if she had the Johnson & Johnson, then it would be just one.
Yes, I'm sorry, I perhaps wasn't as clear as I should have been. If you have, I was talking about a vaccination. I wasn't particularly paying attention to Johnson & Johnson,
Okay.
which is not actually available in the Gulf at this time, not as far as I know. So if you have that allergy and you've had a Johnson & Johnson and no reaction, that's it. No more worries.
Okay, so I have a couple of questions around immunity. And I'm not sure whether I understand this clearly, but somebody got their first dose in January, second dose in February, and they had the antibodies test, which shows 4.50. And they're asking if they should get a third dose.
The answer to that is no. The 2 doses of the recognized vaccine at the prescribed gap between the 2 vaccines is perfectly sufficient at this time. And it's not a question of having a booster to try and increase your immunity, because your immunity may be maxed out already. So having a third dose, in some cases, they've tested in the lab, the third dose, which they're given experimentally to animals, does not increase their immunity. So if you like, there's only a certain amount which you can rise to. I don't know if people know about it, but dogs and cats get COVID as well. And they can actually spread it between themselves and their animal communities, as well as actually having the potential to spread it to humans. That's why I actually advise people not to keep animals in the living part of their houses. They should have a separate area, or the dog should be outside, or the cat should be outside. I know it sounds hard, but thinking of that little pussycat curled up on your bed and making purring noises there, that may not be exactly what the medicine you want if that pussycat's been out and playing with others in the garden. You know what I mean? I don't mean to be comical about it, but I just, this is all so serious. I think I need to add a little levity to it.
Yeah, no, I read somewhere the cats tend to spread it quite a bit as well. Yeah. Yeah, and we don't think about that. We don't think about the animals carrying it. At the moment, there's so much talk about social distancing with people, right? And it doesn't go with cats and dogs. Yeah. So there's somebody else who had antibody question as well. And apparently they said, and this is what they've written, that their antibodies showed a result of 1.76. And then they're asking, is it advisable to take another Sinopharm or Pfizer shot, as the UAE newspapers have been promoting as quoting health authorities and stating people with low antibodies should take Pfizer as it boosts the antibodies?
This is a professional opinion which you need to discuss with the doctor. It's not an answer I can give a general response to across the board. If there are people who are immunodeficient and cannot mount a sufficient immune response, there may be medical reasons to consider some further action. but that is on an individual base only. It's not a general rule. There are definitely some people who are unable to mount a response. And as I said before, if you've had the stimulation with the injections, with 2 jabs, and your count is low, then you need to take very good care of social distancing, hand washing, wearing your mask at the appropriate time, not going out to visitors' homes. Be careful when you go out into the community and take extra precautions because you have low immunity or you're unable to mount a sufficiently high. But having said that, you still have some immunity, whereas without those jabs, you have none, unless you catch it. And when you catch COVID, it is not completely sure that you will maintain that immunity thereafter and not need a vaccine per se. You will need to have, if you catch COVID-19 and recover, you should have the full regime of COVID vaccination 90 days, not before 90 days has elapsed since you recovered. Okay? So if you like to link it to another viral infection, which is very common, chickenpox. Another one is measles. If you catch that and you get measles and recover from it, you still will benefit from having a measles injection, vaccination, and chickenpox as well. So you still have some immunity. Just be very careful on how your personal behavior and your contacts are, if you like, mingled with, and what your social activities are. There is, I repeat firmly, there is no definite across the board indication for a third shot after you've had your first 2. In fact, some of the Gulf states have stopped doing antibody testing because everybody was asking it and everybody had immunity and nobody, very, very few people had a problem, but we knew nothing about it at that time. And now for the past 3 months, 4 months, that has stopped, certainly in Qatar. They don't do it unless it's for people who've had things like renal transplants or organ transplantation or something like that, or another autoimmune disease.
Yeah, so that takes me to another question that actually asks that, whether there is an antibody test to gauge if the vaccine has worked or not.
Let me put it this way. If you have a vaccine, have a vaccination shot, your antibody level is 0. 14 days later, it rises. And it's like a step up. Then you have your second shot, and that causes the body, which is already sensitized, to shoot up to a maximum level. And that's it. So you might well say, you know, I took my car to the garage and had the oil change. It's a month now, and I'm worried that the oil might have gone off. Let me go to the garage and have it checked again. And the garage man says, it's perfectly fine. Are you sure, you say? Yes, it's absolutely fine. So stick to protocols, stick to the guidance, stick to the advice of the scientists and the experts who are dealing with this all the time. An antibody test, once you've had 2 shots of a recognized vaccine, including Sinopharm, and if you have no other indication of illness, an antibody test is not necessary. It's a waste of money, it's a waste of time and resources. Only for a very few people who have certain conditions, and once they've explained those to their doctors, the doctor will make up their mind, he or she, and say, I think this is an idea, but it's on an individual basis. And some people are capable of mounting an immune response which is so strong that they can actually become unwell with it. I know definitely of people who had a very strong response to the second jab and became quite unwell for several days after the second shot. but they all recovered.
Okay. Yeah, so I have an interesting question. And this person is saying that their dad got a first dose of the vaccine, and then later on, a few weeks later, tested positive for COVID. Can they take a second dose?
Not
Or
for
when?
90 days. Not
90
for 90
days.
days. So you can have the vaccine. The vaccine is not foolproof, and you can contract COVID after having had one vaccination because your immunity is not at its maximum level, not for the 2-dose vaccines. So you can catch it, but you will not get it as badly, and you should not end up in hospital. But if you do catch COVID and it's proven via PCR test, you should not have your second vaccine for 90 days.
Wait 90 days and
Wait,
then get your
then get it.
second shot.
Yeah. Some places are considering doing it in 60 days, and in children, it can be done even sooner because their immune system is not as well developed as adults.
Okay. And there's a question from Salima saying that how long does the Pfizer vaccine provide immunity against the virus? Is it like 6 months or a year?
We don't know. We have yet to find out. It could be 6 months, it could be 3 months, it could be 9 months, it could be 2 years, it could be even longer. We don't know. So the thought is that if they find that the study finds that people's response is maintained, they won't need a shot again in a year or two. The flu vaccine, which is a cousin of COVID-19, the virus, coronavirus, is very fickle. And we have to have that, we should have it every year. And that's been going on for decades now. We have barely 6 months history of COVID-19. We don't know how long it lasts. We will know better in a year or two. But at the moment, we follow the guidance. We should not act on our own and say, I think it's a good idea to do this and I'm going to do it anyway. You might have consequences which you did not bargain for and regret it.
Yeah, no, you're absolutely right. Yeah, and it's like they're still measuring blood levels as we go, and we'll only know as we go. We don't have a crystal ball as to how our bodies are responding. So there are some questions here. So I'll just tackle one key question that says, if you're young and healthy, do you really need to take the vaccine?
I'm going to take a moment to pause there and let the questioner think about what has been asked. Without being emotive, we know the devastating effect of COVID-19 vaccine. And I had a patient who was 2 years old and caught COVID-19. The parents didn't give it to them, they were fine. It was actually transmitted to her by an outside party. Can you imagine how worried the parents were? Helpless, no vaccine available, only supportive care, relying on a 2-year-old baby's immune system inherent for it to get better. There's a happy ending. The child survived, no problem. But looking at older age groups who are within the group of vaccination, wouldn't you want to protect that child with everything you have, with all the scientific evidence that you have? Or would you just say, nah, they're pretty healthy, they've never had a problem, they don't need a vaccine, they'll get through it? I can tell you that one of the highest percentage of people actually suffering badly and ending up in hospital, and in some cases dying, are because they haven't had the vaccine. The highest death rate now from COVID-19 is in those people who have not been vaccinated. So my answer to that is categorically, if your child is within the eligible age group, whether they're robust and they've been perfectly healthy ever since they were born, but the vaccine is available, don't go lightly in it and say, nah, they don't need it. Let them have the opportunity. You are responsible for them until they're 18. It would be a tragedy if a 15-year-old who was eligible for the vaccine had parents, should I say, who said, no, we didn't get her vaccinated, and ended up in a disastrous result. Are you prepared to take that risk? I'm not. I wouldn't. So the answer to that is categorically, if the vaccine is available between 12 and 15, and if it does happen, under 12, I would take it. Just like all children who are born have their triple vaccines and their pentavalent vaccines, and they have their diphtheria, their tetanus, their pertussis, their polio, and their MMR, etc. And all these vaccines are given to perfectly healthy children. So why would you stop? Because of something someone said, or perhaps because of just lack of information and hesitancy, and worst of all, for those people who persuade you that by taking the vaccine, your children will die anyway. That is mischievous and malignant, and it's a total fabrication and a false news. I'm sorry to say that. I'm a scientist, I'm a professional, and I am quite prepared to shout out things I don't believe in. But for those who say the vaccine is not worth taking, they have a misunderstanding of the true value of how their children can be protected in this world. I think I've made my point very strongly. There is no doubt in my mind.
Yes, I think your message is very loud and clear, Dr. Bertie, and I totally agree. I think especially for those of us who go into clinical situations and we see the devastating effects of COVID-19, and more so now with the new variants in younger people as well. So sometimes people can get too comfortable where they do not see what happens, thinking this is just like any other. It could be like a cold, we'll fight it, whatever. It's a very different ball game we're dealing with COVID-19. And we can see just the way it's changed the world. So I'm totally on the same side as you as far as vaccination goes. That this is the only way we can beat this thing. And it's unraveling as we go. And we're dealing with variants as well. So as we go, we'll find out more and more, but vaccination is the way to go. So I have some more questions, a couple more questions here. And one is, does Qatar allow other vaccination from other countries?
The answer is yes. Provided they actually are recorded officially, they have a stamp, they have a date, they have the full name, and they have a certificate. They don't quite have cards like the Gulf region has got very organized and has a card with all the information on it. It's not essential, but it's also more helpful to have the batch number of the actual vaccine written on the certificate. BO3NJ2, whatever it may be. It doesn't mean anything to anybody, but it's a number and that can be traced. So if you come from Canada and you've had 2 doses of Pfizer and you've got hard copy certificates, which you can produce at the airport in Qatar, and I think in Dubai as well, as far as I know, and in fact the Gulf states, and they're verified and they're genuine. Of course, you have your app, which you have to show. If you're a returning resident, it'll be on there already. And if you had it out of the country while you were out of the Gulf state or resident place, you can prove it. You should be waived from any quarantine regulation and be able to go straight into the community. They've eased back on it, and now you do not need to quarantine in a hotel. However, there are exceptions. So at the moment, and Dubai is created a rule as well as Qatar, that they're not accepting flights with passengers from India, Bangladesh, Pakistan, Nepal, Sri Lanka, and Kenya, unfortunately. So those people, if they're returning residents to either Dubai or to Qatar, they have to go into quarantine isolation. That's the rule, even if they have had 2 doses of something. Okay, so the long and the short of it is, if you're in a country which gives the recognized vaccines and you come to the Gulf, you will be allowed in, if you're a resident or have a resident permit, to that country without quarantine.
I guess you would answer the next question as well, that if you took the Pfizer in Qatar, and then let's say you go to another country and they don't offer Pfizer, you'd be okay taking a different vaccine and that would be accepted as a second vaccine?
Well, it would be preferable, as I say, to take the same vaccine that you had in the first, because that's actually proven through science. But if you actually had the opportunity to receive a Moderna vaccine on top of your previous Pfizer vaccine, as long as it actually was done within the parameters. So for instance, you have to be 18 years old for Moderna, and you only need to be 16 for Pfizer. So if a 16-year-old goes with 1 dose of Pfizer, they actually have to wait for 2 years before their Moderna can be recognized. So it's best to stick with the same variety if you can possibly get it. Now, in the West and the Northern Hemisphere, there seems to be much more vaccine available. I don't think it's a question of waiting for one particular vaccine to come on tap and be available. If you need protection, I would advise the following. I would say, if you are in Qatar or in Dubai and you have a Pfizer shot, your next shot is due in 3 weeks. 3 weeks. Do you have to travel immediately after your first shot? No. You can delay it. Have your second shot in your country. Wait 14 days. Then you're fully immune. You will be recognized in places like Canada and the US, no problem at all. That is the answer. So unless there's some really pressing reason, like a death or something emergency, where you have to rush off, complete your course before you leave the country. And that removes all margins of error, complication, misunderstanding, confusion, etc.
No, that's fair enough. So just be sensible and weigh out your options. And like you said, like, is it really important to be out of the country and not just wait until you've got your second dose? And that makes total sense to me.
And this question has come up with me personally with patients who said, I'll only have time to do my first dose, then I have to go away because I've got a commitment. And I've gone back to them and say, you just have to wait 3 weeks, because if you have 1 dose and you go away and you've only had 1 dose, when you come back, you're going to have to go into quarantine, stay in a hotel, all the expense, etc., etc. Do you have to go? And they said, yes, I do. And I said, think very seriously about staying for the extra little time and getting completely vaccinated before you go. And then later on, I had an email from them saying, I took your advice, I waited, I've had my second dose. I want to let you know, thank you. That's the way to go. If you're having Moderna, it's 4 weeks. If it's Pfizer, it's 3 weeks.
Yeah, so important to take that moment to pause and think about what your priorities are. So there's one question, and we're back to Sinopharm, but I just thought it was slightly different, because this person is saying that they had 2 doses of Sinopharm, and it's for a senior. The immunity was really low, and it says the family doctor said to take the 3rd dose. And I'd like to know your opinion. Immunity percent was 7.46.
I myself would not have advised that, as seniors do have a lower immunity level generally. 7.46% is not a bad value. And as I said, that is an individual assessment. But I do not think it's a good idea to give something to somebody because it seems like a good idea. There is no evidence for seniors being more protected with another dose of another vaccine, in this case, Pfizer. As I've already said, Sinopharm was seriously underestimated in its efficacy. And I think that 76%, if you were actually to get 76% in an exam, you'd feel quite happy about that, I am sure. Yeah, sure, you'd like to get 80 or 85, but 76 is very respectable. And I don't think there's any indication for giving a third dose for an idea that it might increase immunity. I've already explained that. Once your immunity has reached a certain level, it doesn't go up. It's like adding water to water. When you have a glass which has got almost full of water, you cannot dilute it. You can't concentrate it. If you add more water to it, it's just going to overflow and make a mess. It's not going to give you any strength or change the density of the water. And it's the same principle here, although of course there are slight differences. So I would be very wary if this is general advice and what this particular doctor is doing. It is not advised. And in the medical fraternity, if you do something which is not accepted normal practice, and there's any consequences because of that, that professional doctor may be sued. I wouldn't want to take that risk. I'm not afraid of the law because I know what the law is. And patients should not press their doctors to say, I want a third dose or else I'll go and get it somewhere else. The answer to that is my recommendation, no, and I would advise you not to go somewhere else. But that is entirely your choice, but I'm not giving it to you. And I would advise people not to go and seek out because they think it's a good idea.
So I think this takes me actually to my last question, which I really want you to address, because I think sometimes we can get very comfortable once we're vaccinated. And the question is around wearing masks and social distancing once you're vaccinated. And especially when we've got quite a few questions about low immunity and what to do. So what is your advice? What is your answer to, do I continue wearing masks and being vigilant after I'm vaccinated?
There will be a time when we won't have to wear masks outside. But until that regulation is lifted by the Gulf community governments, the Ministry of Health, we must comply. You might get hot. It is hot. It's going to get humid. It's going to be uncomfortable. But first of all, you are protecting yourself. And second of all, you are protecting others. That means your family. So even if you're well and you feel okay and you're fully vaccinated, you can still be a passive transmitter by simply getting some droplets from someone talking to you, spraying you, and you unwittingly going home and, cuddling your child or whatever, and passing that on. Now, the three places which are very important are your eyes, your nose, and your mouth. And the virus can get in to your body through these wet surfaces. Now your eyes, I've got glasses, but that doesn't protect me. But if you have sunglasses and you're talking, you have glasses, you've got some limited protection of your eyes. When I'm at work, I wear a face shield, so I don't get anybody's breath in my face. Your nose should always be covered. I have to say, it is very distressing to see people wear a mask like this in public, and they go around, and I'm not sure whether they think it's cool or not, but it's not effective. It has to be over your nose and chin and cover all around. Now this is a soft mask, and it's quite comfortable. It's an N95. It does have gaps. I'll just take this off for a moment. It does have gaps around the side. So some of the air comes out of the side there, but it's directed away. And you're not going to inhale necessarily people's breath coming straight to you. Now, one of the criticisms of this is how people handle their masks, because you may be safe. The virus could be on the outside, just on the very surface, not penetrating. And you need to be able to handle your mask properly. So when you do have a mask and you put it on, this is used, I'm not going to be using it again. You need to put it on and you need to touch it as little as possible. A lot of people you see out in the public in various stores, they're constantly fiddling with their mask, pushing it up or what have you, etc. And their hands are maybe contaminated. So there's a risk there. And then when they take their mask off, they do this kind of thing. Hold it and sort of put it in a pocket somewhere. That's completely the wrong way to wear a mask. What is a mask for? We actually used to be rather unkind. People in the Far East used to come and land in the West, in North America, for instance, people from China and from Hong Kong and from Korea with masks on. And people used to laugh and say, what do you think we are? You know, full of infection, etc. Now the laugh is on us because they actually have done very well in protection. And we actually didn't wear masks ever. And you know how badly some countries have suffered. So this is a hard mask. This is an NP95, okay? And it's a hard mask. And that has a little nose thing inside which you bend to your nose, and it covers your whole face. And it's very secure. Not much gets through this. It's not so comfortable to wear, but it's one of the best masks to wear. Anything that can protect you against infection is worth doing. My advice is to have a supply of masks. They don't cost very much. They need to be handled carefully, and I would wear them where you feel you might be exposed to a risk or you want to protect others. So when you're at home, in your own home, you don't need to wear one if all the family is safe. But if you go to a shopping store where you're mixing with people you've never seen before and you've no idea where they've come from, I think it's entirely sensible to wear a mask, so long as you don't keep touching it and fiddling with it and behaving badly, like stuffing into a pocket. These should be put into a plastic bag every time they're taken off, and they should be not used forever until they look grubby and dirty. If they get grubby and dirty, they should be discarded. Face masks, the surgical masks, are very easy to use and very effective. They're not 100%, but anything you can do to protect yourself is worthwhile until the regulation is lifted. And I dare say that some people are so used to wearing face masks that they will continue to do so when they're around sick people. Unless you have your own office at work where there's nobody else working in the room, if you're in shared space, 3 or 4 people, I would certainly recommend at work that you wear a mask whenever there's someone else around in close proximity in your office. That's a personal feeling, and that may be a regulation imposed by the firm or the government. At the moment, we're not free to go out and not wear a mask. There are exceptions, but those are exceptions. So the answer to that is yes. And I will admit that initially when COVID started, I was not convinced that masks would be necessary, but I changed my mind and I'm entitled to do that. And I strongly and firmly believe that they are useful now.
Yeah,
and will continue to be.
Yeah, no, point taken. And I completely agree that we need to remain vigilant as we move along. So thank you so much, Dr. Bertie. These were some very tricky questions.
Once again, thank you, Dr. Virji. It was such a pleasure to have us with you today. Audience feedback shows that they have found this webinar to be very informative and provided them with a better understanding on the current situation, and they would like to express their thank yous.